As surgeries for lymphedema and lipedema become more popular and effective, I'm excited to be doing this series on the current surgical options available to patients. I do this with the understanding that surgical procedures are constantly being updated, modified, changing, and improved. So please keep that in mind. It's also important to mention that not every procedure is appropriate for every patient. So all options must be discussed with your own personal medical providers. Today's study is entitled Breaking the Circle: Effectiveness of Liposuction in Lipedema Patients. It is performed by Tobias Seefeldt and team from 2023. This study was performed as a survey to patients and mostly over social media, which I think is important to mention as I begin reporting on it because we're taking everybody's word for what it is. This study defines the stages of lipedema as follows. Stage 1, thickened subcutaneous fat while the skin is mostly smooth. Stage 2, skin may be uneven with signs of peau d'orange or orange peel skin with palpable nodules. Stage 3, the skin is showing higher grades of deformation with skin folds and divots lying in harder and coarser skin. Additionally, a development of secondary lymphedema may occur with progression of lipedema. So for this study, patients with a lipolymphedema were considered stage 4. 860 patients completed this survey, and outcomes looked at pain, BMI, and comorbidities with surgical intervention. 99% of patients who responded were women, which is indicative of the patient population as we know it. 14% of patients had stage 1 lipedema, 61% had stage 2, 19% had stage 3, 2% had stage 4, and 3% of patients did not respond to staging questions. Survey results showed that 88% of participants noticed the onset of lipedema during times of hormonal changes, and 56% had the onset between 13 and 18 years old. Again, these results are typical of what we currently know to understand about lipedema. The surgical interventions that patients had undergone are 74% of liposuction procedures were done in lower legs, 49% in upper arms, 42% in the buttock area, 40% in the lower arms, and 20% in the abdominal area. 73% of patients received more than one procedure. Now, prior to surgery, 98% of participants reported pain in the body from their lipedema specifically. Of the patients who had liposuction, 96% reported a decrease in pain, 3% had no change in pain following surgery, and only 1% had a reported increase in pain following surgery. Regarding comorbidities, many patients had at least one comorbidity, including menstrual pain, insomnia, migraine headaches, allergies, depression, and lymphedema, just to name a few. It cannot be stated that lipedema caused these symptoms or if these comorbidities caused the lipedema. Lastly, the study shows a significant correlation of BMI and degree of lipedema. Other tests should be considered to provide a more accurate picture of adipose tissue deposition. Pain and dysfunction are the two biggest complaints I hear from my patients who have lipedema, so I know a lot of you are suffering from that as well. And while recovery is not easy, it is not fast, and it requires a significant long-term commitment to follow-up, I do believe that lipedema surgeries are successful. Full details of the study can be found in the link below. I hope you find this information useful. My name is Lisa Berman Sylvestri. I'm a physical therapist and a certified lymphedema therapist, and my goal is to make us all lymph smart.